Welcome, everyone. For those of you joining as you're let in, we're excited to see you today. We're going to wait for about 2 minutes total just to let Zoom fill in. If you have an opportunity, it would be great to put your name, organization, and location into the chat box just to give us a sense of where people are from. Again, thank you all. I see the numbers going up. We'll start in about a little bit less than a minute, but if you get a chance to put your name, location, and organization, it's great for us to see where everyone's coming from. Okay, well, great. So we just passed 100 who've gotten in the room. So let's go ahead and get started. It's really great to welcome all of you here to today's Network Commons. This is a long-running series now of live conversations between leaders across sectors. Today is special because it marks the 10th anniversary of the Build Healthy Places Network. So today we're going to look back, reflect on the past 10 years, as well as look forward to hear about where our work might go next. For those of you new to us, BHPN is a nonprofit based at the Public Health Institute in Oakland, California. We work nationally to transform the way organizations collaborate across the health, community development, and finance sectors to more effectively reduce poverty, advance racial equity, and improve health in neighborhoods across the United States. My name is Doug Judy. I'm a pediatrician and public health researcher speaking to you today from New York City, on the island of Mannahatta, the original lands of the Lenape people. And I'm excited to say that this is my last Network Commons. I stepped down as BHPN's founding executive director last month, and I'm excited to be able to introduce our two new co-executive directors in a bit. But before we go further, I wanted to introduce a particularly important person to me and to the Build Healthy Places Network. Amy Gilman is a senior program officer at the Robert Wood Johnson Foundation, but in her life before RWJF, she was the National Program Director for Community Health at the Local Initiative Support Corporation, or LISC, one of the country's largest community development financial institutions. But more importantly, Amy's a very long-term friend and colleague. Early in our work, she was my sounding board, my thought partner, my go-to panel speaker. So it's been a real pleasure to have her also in the recent years as our program officer and our champion at Robert Wood Johnson Foundation. So Amy's going to kick us off with some overall reflections from her long experience in the intersection of community development and health and her work with Build Healthy Places Network. So thank you for joining us, Amy.
Thank you, Doug, and good afternoon, everyone. I'm really delighted to be here today to welcome you all to this Network Commons event to mark the 10th anniversary of the Build Healthy Places Network. I'm really excited to hear from this impressive lineup of field leaders about the progress and achievements in elevating the role of community development in improving racial equity and health outcomes, and on what the future holds for this work. RWJF is committed to improving health and health equity in the United States, and in partnership with others, we are working to develop a culture of health rooted in equity that provides everyone with a fair and just opportunity to thrive, no matter who they are, where they live, how much money they have. And we know that health is more than absence of disease. It's a state of physical, mental, and emotional well-being, and it reflects what takes place in our communities. And that's why RWJF focuses on removing the barriers to health that are caused by structural racism and other forms of discrimination, and on addressing the drivers of poverty, segregation from opportunity, and the historical lack of investment in communities of low income and communities of color. And the foundation helped launch the Build Healthy Places Network in 2014, based on a key recommendation of our Commission to Build a Healthier America that elevated the need to fully integrate health into community development in order to revitalize neighborhoods with the most significant health disparities. And we wanted to provide the field with a way to learn and connect around cross-sector solutions to community investment that address barriers to health and racial equity and lead to healthier and more equitable communities. And it's just been incredible to see the evolution and accomplishments of this work over the last 10 years as Build Healthy Places Network has expanded its network of collaborators and funders and has played a sought after and influential role as an effective and neutral convener, facilitator, matchmaker, knowledge spreader, translator, and reliable source of timely evidence-based information, data, and tools. And it's also important to recognize how Build Healthy Places Network has increasingly centered its work on racial equity and extended its reach to places and people that have not previously received or benefited from investment. And on a personal note, it's really a treat for me to be here today because I participated in the Build Healthy Places Network inaugural Network Commons back in 2015 when I was at LISC, as Doug mentioned, before joining RWJF a few years later. And I just remember how the network quickly became my go-to source on all things at the intersection of community development and health at the beginning of the community development sector's awareness about the potential health impact of its role. And so with that, I will turn it back to Doug and congratulate him on his 10 years of leadership.
Great. Thanks so much, Amy. And, we want to thank the Robert Wood Johnson Foundation for being our initial funder. We're very fortunate that we have many others who support our work, the Blue Shield of California Foundation, Kellogg Foundation, Kresge Foundation, California Wellness, among others. So that's been really exciting to watch that interest spread. And as much as, as much work as we've done, and I would encourage everyone to check out our website, show what we've put together over the last decade. Kevin from our team is going to drop some links into the chat during the conference or during the conversation as we get an opportunity. But I think the important thing is, as far as we've come, there's a lot further to go. And that's part of the conversation we're going to have today. The early excitement of bringing together folks from different sectors where we bring them together in conferences, and some of you spoke at these meetings, there was just a palpable excitement about bringing health and community development folks in the same room. And what the Build Healthy Places Network really tried to do was to create a sense of field around that work, to create a shared language and shared goals and bring people together who might not otherwise know one another. So it's been really exciting work. I want to introduce our speakers, and again, keep an eye on the chat box. And once we get to the Q&A, you can put, or at any point, we'll put some Q&A you can put your questions in the Q&A box. But today for our speakers, and we can go to our gallery view, our panelists today, I'm very excited. These are some super important people to us over the years. I'll just run through them quickly here. Nancy Andrews is the past CEO of the Low Income Investment Fund, which is a prominent national community development financial institution, or CDFI, and a longtime leader in community development collaborations with healthcare. John Vu is Vice President of Strategy and Community Health at Kaiser Permanente, which is a national healthcare provider and health insurer and an innovative investor in housing and communities. Chris Iglesias is CEO of the Unity Council, a leading community development corporation, or CDC, and developer of the nationally renowned Fruitvale Transit Village in Oakland, California. And Tony Pickett is CEO of the Grounded Solutions Network, a national leadership organization for community land trusts and other forms of shared equity and community-owned housing solutions. So those are our panelists, and we'll also be hearing a bit later from our two new co-executive directors, so Ruth Thomas Squantz and Colleen Flynn. So I just want to thank all of you for joining us today. So for the first portion of the discussion, I'd like to focus on where we were and where we are now, and so really the path between the two. And I'm going to turn to each of the four panelists and ask sort of, again, where have you seen us, this intersection of health and community development change over time? So Nancy, let's start with you. You were one of the founders of this effort to better connect these sectors. In fact, you were the lead author in one of the very first publications from the Federal Reserve Bank of San Francisco's Journal of Community Development Investment Review that was called Community Development and Health. It was a special issue in 2009. So you've really been a prominent thinker in this work since the beginning. As I mentioned, you led the Low Income Investment Fund, a national CDFI for many years, and you've been chair of our National Advisory Council for a number of years. So you've got real insights in this cross-sector field and BHPN's role in it. So the question for you is, how, from your perspective, how has work in this area connecting health and community development changed over the years? Where are we now compared to where we were then? And are there barriers that you've seen us overcome so far? Oop, you're on mute, Nancy.
Oops. All right, Doug, thanks so much. I really, really appreciate that introduction. And I'm grateful for those questions, but before I try to respond to them, I do want to say, Doug, what a personal delight and what a privilege it's been for me to be able to watch BHPN come into being, to grow in its in its stature, and its reach, and in its contribution. And the vision behind all of this really, Doug, while I know that there's a team effort that's built the organization, the vision and the drive to make it possible, the spark behind it really came down to you. You've made a remarkable contribution in the field of community development and the linkage of the social determinants of health with this field. And I want you to know that when you head off to Rio tomorrow, you will be sorely, sorely missed. But having said that you'll be missed, that's also a signal to tell you that we will be standing by with eagle eyes for when you get back from Rio, and we will be looking at what your next contribution is going to be. And we are going to be ready to jump in and carry on the fight with you, whatever that is. So thank you, Doug, for everything that you've done. When I reflect on the past 10 years, the very first thing that comes to my mind is actually a remembrance or a recollection of a conference that was hosted in New York by the New York Federal Reserve. This was just a couple of years before the spark of the idea of BHPN came into your mind, Doug. The conference was focused in part on the social determinants of health, and also the role of community development in promoting that. And we had asked a number of investors, Bank of America, Goldman Sachs, Chase, a number of other ones, to talk with us about how they invest in community health and in healthy communities. And the response that we got at that time was, oh, sure, we're happy to talk with you about the investments we make in health clinics. Now, that was really the original thinking, that what human health was all about was about health services. But boy, have things really come a long ways, and have things changed. At that time, 10 years ago, the idea of the social determinants had not really penetrated the thinking of many of us. But today, if you talk with those very same investors, you would get remarks about investing upstream in things like housing and early childhood programs. That's a huge, huge marker of change and of success. Another one, another marker that comes to mind is if we can all cast our mind's eye back about 10 or 15 years ago, the community development field at that time was really engaged in a pretty fierce debate about its strategy. There was what we called the people versus place debate, and it was in the forefront of everyone's minds. Many community and development investors held that investing in communities and place was the key lever, the only lever really, to human progress. And others thought that maybe there was some role for investing in people, not just in place. But if you fast forward to today, what you can see is that fierce fight has really come to an end. And I think it was highlighted for me the most by Federal Reserve Governor Betsy Duke, who said in a preface to a book, "The people versus place debate is over, and both sides have won." And I think most of us now have come around to that point of view. And the idea of thinking about healthy communities without also thinking about population health and community, the people in those communities being healthy, is not in anyone's mind. So the next question that you asked me, Doug, was where do we need to go over the next decade? And what I'm going to do is focus at the super high level, which I think will tee things up for my colleagues on the panel. Much of the work of linking the field of community development and the field of health is coming from the ground up. It's coming from practitioners like Tony and Chris and visionary thinkers like John that are putting some money behind this. It's coming from many of you who are in the audience who are doing pretty amazing work on the ground. But the larger infrastructure of how we support that work, how we fund it, hasn't really changed very much at all over the past 10 years. And I would urge you to think and reflect on how important it is to begin making broad systemic change that will reinforce and accelerate what's going on the ground. For example, if you think specifically about the Department of Housing and Urban Development, and you think about the Department of Health and Human Services, you realize what a gulf there is between those two very, very critical delivery agencies. We know that a low-income family is touched by about 10 to 12 federal agencies every single day, but the support that they get is siloed, it's separated, it has different goals, it has competing rules and competing administrations. So if we could possibly imagine a different future, that for funding and the goals of many of our public programs were centered instead on healthy people and healthy communities, on human mobility, on economic justice, that rewarded and funded this kind of silo busting work that's being done by practitioners, I think that's the kind of vision that we need to go. Now, many of my colleagues will say, oh my gosh, please don't talk about policy. All I can see is 10 years of my life going before my eyes and not a single thing getting done. But I do want to say that we as practitioners really are the ones who are best positioned to make change. We have the loudest voice, we have the most credible voice, and I would submit that we have the most common sense about what works than anyone else in the room. So for the next decade, what I would urge is that you keep this very broad and big vision in mind, and that you put your hearts and your practice into achieving that. Because the track record of community development and public health is that when we have a vision, we make it happen. So thanks, Doug.
Thanks so much, Nancy. That was really great and very helpful. And thank you for the kind words. And I think I really appreciate the focus on policy as well. And actually, Kevin and team, if we could put in the policy scan that we published, I think a couple of years ago now, which really was looking at existing policies across the country that are in fact enabling community development and health collaboration at the local, state and federal levels, it might be a good resource. John, you're next. So you've also been a National Advisory Committee member for Build Healthy Places for a while now. You've obviously been present and played key roles at Kaiser Permanente, helping them become one of the most forward-thinking healthcare systems in the country in terms of investing in neighborhoods. And in fact, if I have the numbers right, KP has invested $400 million, almost $500 million through partnerships with leading community development organizations to build affordable housing and other critical infrastructure. And that money is not just grants, that's also coming out of your investment portfolio. So it really is a different way of framing this work than just the sort of community benefit process. So that represents real progress. And certainly Kaiser Permanente 10 years ago, when I first had the opportunity to work with folks like Tyler Norris, was not thinking in this way. And so can you say a bit about what that transition has looked like, and your experience? How can what you guys have done and experienced be applied or built on by other healthcare systems?
Yeah, thank you, Doug. Yeah, I wish, as Nancy was giving you the platitudes, I wish today could be a toast to Doug, and then I wish actually we could have a roast for Doug too. But another time, another place for that. There's plenty of ribbing that we could do with Doug here. But I'll try to stay focused here. And I think in many ways, our journey as a health system and many other health systems over the last 10, 15 years kind of mirrors and has evolved with the way social determinants of health have evolved. In the early days, like people trying to finally understand that health is more than health care. And despite being around for 70 plus years, being a mission-driven, not-for-profit system, priding itself on prevention and even upstream sort of interventions for health, we realized that as we were hearing about the science of social determinants and why they matter, that we weren't doing enough. We actually, and we called ourselves a total health organization, but were we really living up to those ideals of the totality of health in that way? And that providing surgeries, drugs, mammograms, health education is great and great coverage and access, but is that ultimately going to deliver on the mission? And then we also started looking at, I think many health systems looked at their mission, especially the not-for-profit ones, and everyone's got some component of individual and community health as a part of that. And at the same time, you mentioned community benefit. We've always had this obligation for community benefit, but for 30, 40 years, it was about accounting. It was about charity care. It was about Medicaid and those kinds of losses. But you've got this huge obligation, and how are you living up to that? So I think that confluence of both the science, the attention, the intellectual framing that was coming out. I mean, I'm glad RWJ was on here, because we looked a lot to, as the county health rankings coming out of the University of Wisconsin started showing, not only do these things matter, let's start quantifying it, and let's actually benchmark it, state by state that way. We started saying, well, yeah, are we doing enough, and are we living up to our mission this way? And then I think we had some luck. We had some forward-looking board members who realized we got this community benefit thing, but what does it really mean? Is there really a strategy behind it? And really, ultimately, what are you trying to achieve with it? So the board, even around the 2000, 2001 period, pushed us to kind of grow up about that and think about being more deliberate and intentional, creating infrastructure, creating a community benefit committee of the board, hiring a dedicated community benefit, community health leader. And we were lucky to have a very progressive-minded leader who hired very public health, progressive-minded people to think about this. And then we were given a lot of latitude to experiment and be somewhat entrepreneurial. Well, what if we did try to work on food deserts? First of all, we figured out what food deserts were. And what if we did try to work on food deserts? What if we did try to think about PE policy for schools, and what would upping that game look like? And that showed the organization that it could play outside its lane, think beyond its four walls, and then experiment a little bit. And the world was starting to kind of tell us more about how to do this thing. And then we started finding, like, well, who are the partners? Since we are definitely naive, especially when it comes to long-term community development work. And we found places like Enterprise, LISC, LIFT, started reading the literature and seeing what they were doing. And then we let our grants kind of, our money follow the path there a little bit. And like you said, a couple of few $100 million of grants on top of $400 million of impact investing. What that really represents, and I'm glad, I think Tyler Norris is on here because he was on the vanguard within KP for this, to help really think about, what about all your assets? And not just sort of a philanthropy thing here or there, or a nice donation, or an occasional health fair or whatever, but really, if you think about, especially again, if you're a not-for-profit health system, in some ways you have an obligation, but in some way there's this moral imperative that all of those exist and can exist for greater good. So you think about how you hire, how you purchase, who you purchase from, how you use your land, how you build, i.e. the anchor strategy. So that kind of emerged, that slowly followed after this awakening around social determinants. And again, linking all of that to why you exist, and you exist to improve health. And are you doing enough to drive health? And when you take this broader notion of what it was. So that really was, many years journey. It was a lot of retail politics. Like we met with so many departments and tried to show them charts and maps. It was hearts and minds. We told them stories about things that could go on. And really, I think people bought into it and understood, if we were going to live up to our ideals, these are the kinds of things that you need to do. And then I've been very heartened, as I've been a part of the American Hospital Association's community health initiatives, and seen my peers, many come along with this journey. I think we still have a long way to go. And when we get into sort of more forward-looking topics later, I think there's a lot more work to be done. But I think the world, we're not that leading and progressive anymore. And I'm glad to say that every hospital leader now knows how to say social determinants and even beyond healthcare. So.
Great. Yeah, thanks so much, John. And I did check, Tyler is here. So thank you, Tyler. As John said, I think the great word is you were at the vanguard. Tyler Norris was at Kaiser Permanente and then the Wellbeing Trust, and has been a huge mentor and support for our work and work in this area overall. Chris, let's turn to you. You lead, as I mentioned, one of the best known community development corporations in the country. The Fruitvale Transit neighborhood in Oakland is a model for what transit-oriented development can look like, especially community-oriented, community-led, community-serving transit-oriented development. You and Unity Council were also our very first contract as an advisor to. And it was incredibly important for us and valuable to work with a colleague who was trying to figure out how do we get health to play and the social determinants play a more important role, a lens through which you could see your work. So for you, how's that gone? where are you now in terms of thinking about health? And have you seen this change happen in the Community Development Corporation front nationally in terms of rethinking how community development is a form of health creation?
Yeah, thanks, Doug. And also, I just want to follow Nancy and John and congratulate you for 10 years. I think it's a great accomplishment. Really, really proud of you and really happy for you. I just had my 10-year anniversary here at the Unity Council, and on January 7th. And I have so much more gray hair than you. I don't know how you do it. So, and I know your job's probably way more stressful than mine. I'm like, you're looking good. So congratulations. Well, first of all, I think when we did hire you back in 2016, it was one of the biggest challenges I had was just convincing my staff why we should hire you. I think they were like, why are we going to hire this firm, right? I mean, what are they going to tell us about health that like we already don't know? I'm like, well, there's a lot of things we don't know. And I think it was a really big turning point for us. I think, you referred to us several times as a community development corporation. And I think, yes, that's how we started back in the 60s and the civil rights movement and everything. But I think we've evolved over the years, and now we consider ourselves more of a social equity development corporation, where we're, looking at the whole sector of a person's lives, right? I think there's a slide that we could probably show you just to kind of give you an idea of the scope of our work. Next year will be our 60th anniversary. And, we worked with you to really develop this slide, and it's been a very powerful model for us and for our team and for our partners over the years. You mentioned the Fruitvale Transit Village, and as you can see on the top is, the affordable housing. We've really ramped up our efforts around building more affordable housing. I'll talk about that in a second. Cultural events, career and financial empowerment, early childhood education is our largest program. Which continues to expand here in Oakland and also in Concord, farther out in the East Bay, access to healthcare. So it really kind of gives you the whole spectrum of a person's life, from prenatal to seniors. And then also we always say and beyond with cultural events, because we do a huge Day of the Dead, Dia de los Muertos festival every year. So we got those folks covered that actually leave us too. But you working with your team, you helped us map this out. And I think for us, it was like a big kind of a aha, like, wow, we are in the health field in a way when we do touch many people's lives in that. So you can take that, or you can leave it on if you want. But I think probably from that time, from 2016, we were already in conversations with Kaiser, probably starting in maybe 2014. I got here in 2013. So probably in 2014, we started talking to them about a partnership and certain needs that we had, certain investments. We were coming out of the Great Recession, and we actually had a need for just general operating support. And Supervisor Wilmer Chan said, you need to talk to Kaiser. I'm like, well, what for? I already pay them a lot of money every month, to cover our employees. And he goes, no, they're really forward thinking and everything. So I'm in my office today, and I always keep this right next to my desk because Bernard Tyson was just an amazing leader for Kaiser, for Oakland, for the Bay, for the country. And, he was accessible. I met him several times. His team was accessible. And I think that's something that really is an example of how public the health sector needs to be, right? It can't just be one, individual, one organization taking that lead to get involved in the real kind of grassroots work. But he demonstrated, how it could be done. And his investments, Kaiser's investments with us over the years have been they really helped change the game. And I'm just looking at I've just kind of listed out partners that we've been working with since we started working with you. We always did work with La Clínica de la Raza. They're one of, an FQHC here in Fruitvale. We worked with them for years, but now it's Kaiser. Now it's UCSF, Benioff Children's Hospital on their community advisory board, Alameda County Public Health, Latinx Center for Excellence at UCSF, Samuel H. Merritt, Native American Health, street level, the Public Health Institute. So it's like, it just kind of like blew up, right? And then now also, the leaders that we've been bringing on, our new CFO, our new Chief Operating Officer is a public health person at UC Berkeley, right? He's kind of grown up in that field, and some of our other leaders. So it's really, I think the partnership for us really kind of expanded, like, hey, this is, you guys play a key role in this, and how do we continue to build on it? And I think the pandemic has definitely changed the whole spectrum. And I think we'll talk about that later, like where we want to go. But yes, this has been a really huge partnership for us. I'm really grateful to begin this partnership with you and to continue it. Thank you.
Great, thanks so much, Chris. And just amongst many points you made that are worth remembering is the fact that you hired someone with public health training. You run a social equity development corporation, and you've made that explicit, which I think is really exciting. So Tony, you're one of our newest National Advisory Council members, so thank you for joining us. But of course, we've known of you and your important work through Grounded Solutions Network for a while now. You do great work expanding the public's understanding of community ownership, how to achieve it through mechanisms like community land trusts. And shared equity is a less familiar term or form of community investment. And so could you say a little bit about that work for the audience who may be less familiar with it? And how have you seen the work of community land trusts and other forms of shared equity change in relation to health and partnerships with healthcare over the last few years?
Sure. Thank you, Doug. And like others, I just want to say, I know we're being left in great hands, but you will be greatly missed at the helm. And I look forward to the opportunity to celebrate you in an appropriate way in person at some point. Turning to the purpose of why I'm here, I'll just share as context. For those who don't know, Grounded Solutions is a national nonprofit network right now of over 260 member organizations. Our mission is really to cultivate equitable and inclusive communities, providing housing with affordability that lasts for generations, going beyond the standard subsidy requirements of affordability terms in perpetuity whenever possible is how we like to talk about it. We provide technical assistance, research, and policy advocacy, and really support the use and growth of unique, what we call shared equity housing models. And those include nonprofit community land trusts, but also limited equity cooperatives and municipal deed restricted inclusionary housing programs that are producing shared equity homes. I'll talk a little bit about community land trusts. Those nonprofits typically own land in perpetuity while developing and selling homes on the land which is leased long-term, typically for 99 years with a renewal clause for another 99 years. The ground lease that allows that land to be used for residential purposes typically includes, in the case of home ownership, a resale formula that restricts the amount of equity that is due to a homeowner upon their decision to sell the home. That means community land trust homes remain affordable in perpetuity, serving multiple households over time as a permanent community benefit and resource. I also want to share that racial equity is also part of the DNA of the CLT model. It was created by civil rights movement leaders in rural Albany, Georgia in the 1960s. Those activists included two men, Slater King and his brother C.B. King, who are cousins of Dr. Martin Luther King Jr., who will be celebrating next week. Their efforts resulted in a 5,700-acre communally owned working farm, the largest Black-owned land holding of its time. And that functioned as a practical intervention to prevent what was often the violent eviction of Black tenant farmers and their families from their homes. So a direct means of preventing what we call today displacement. Over the last 50 years, their example has really inspired the creation of over 250 community land trust organizations across the nation, which by our estimates are stewarding approximately 12,000 homes as part of a larger shared equity housing sector of 250,000 homes. But all of that is still minute in terms of the millions of homes that are needed to solve our housing deficit in the country. Shared equity homeownership is often thought about as a third sector of housing that sits between renting and private market homeownership. It often acts as a step from renting to be able to buy a home on the private market. And that has been borne out by a 2019 study that we did in partnership with the Lincoln Institute of Land Policy. Among the findings of that study, which analyzed a variety of shared equity programs over a 30-year period, foreclosure was virtually non-existent. So none of the families were suffering from foreclosure, even during the Great Recession period. It has proven to be wealth creating. The average investment that a family made in purchasing a shared equity or CLT home was $1,800. And after about a 5 to 7 year period of tenure, the average return to those families who decided to sell was $14,000. So within 5 to 7 years, there's not many other ways to get that kind of return on investment. And 60% of those home buyers who decided to sell went on to purchase unsubsidized market rate homes. And also we're increasingly serving families of color over that period of time, with families of color being served at about 13% at the beginning of the study period and 43% at the end of the study period. From a health standpoint, our network believes quality homes with lasting affordability contribute to better family and community-wide quality of life outcomes, which is a key component, as others have said, of the social determinants of health. Providing long-term, affordable, high-quality housing really reduces mental stress for families, simultaneously reducing the probability of stress-induced mental and physical health issues. One really great example that I always like to point out is the Maggie Walker Community Land Trust in Richmond, Virginia. Maggie Walker is funded in part by the Bon Secours Health System. The nonprofit Maggie Walker CLT buys land and builds or rehabs affordable housing in Richmond neighborhoods that are considered vulnerable to gentrification. Based on the legacy of redlining and housing discrimination, those same neighborhoods are most often communities of color. So why, you might ask, did Bon Secours invest in the Maggie Walker Community Land Trust? Again, data bears out the story. A 2017 study by the Richmond Memorial Health Foundation found that the median life expectancy in Richmond's neighborhoods, the high value neighborhoods, ranged from 79 to 83 years, while in other Richmond neighborhoods of color with lower home values, the lower limit of the median life expectancy is only 63 years. So you see right there, there's a disparity in just the longevity that an individual is expected to have between those two neighborhoods. The same study found on average 26 homes per day were bought by white households in Richmond. The same year of the study, an average of 6 homes per day were purchased by Black buyers. For Latino buyers, the daily average was only 2. So our nation's legacy of racial inequity has resulted in a well-documented racial homeownership and wealth gap, as well as health equity gap, which contributes to the challenges of communities of color. And so we're view shared equity and community land trusts as a way to mitigate that and actually change the trajectory from a health and wealth standpoint for families of color across the country.
Super. Thanks so much, Tony. And yeah, good or fantastic sort of initial introduction, I think, for some folks to these concepts that are so important, especially in terms of, as you say, really trying to achieve racial equity. I also want to just thank folks who are putting some links into the chat box, others from the audience. So please, if there's things that you hear that you are aware of, put them in. And we are going to share the video and resources in a follow-up email. So now I get to reintroduce our new and I think improved executive directors. So I want to thank all of you for your insights so far, but Ruth Thomas Squant and Colleen Flynn are going to be taking or have taken over BHPN, and they're going to talk a little bit right now about sort of where they see the field going, and we're going to have the speakers give them the chance to respond. So Ruth and Colleen.
Yeah, well, thanks, Doug. Colleen and I are definitely looking forward to leading BHPN at this sort of milestone inflection point, and inspired by the opportunity to be a women-led organization. And during this transition period, we've really been reflecting on some of the trends that we are seeing in the field and through our relationships with the amazing partners in community development, public health and healthcare fields that we have. We're looking forward to continuing to advance the momentum for this coordinated systems change. And I think it's pretty important that this multi-sector collaboration begins to explicitly center racial equity. I think if we're going to have any chance of achieving the goal of improving health outcomes for all. Healthcare and community development both have ample room to grow and have opportunity really to focus more intentionally on authentic community engagement models. One through line we definitely are seeing that's a combined emergence from the effects of the 10 years of the efforts, but also sort of, I think, honed in by the pandemic is this importance of the movement from community engagement to community ownership. And this model is really summarized in a link, which I think we're sharing, the team's sharing in the chat now, that was developed by Rosa Gonzalez at Facilitating Power. The model outlines that movement of organizations, from informing the community to sort of more deeper involvement and collaboration with an end goal of deferring to community. And I think BHPN is really embracing the ambitions of this model as the disrupting force that's necessary to dismantle systems of structural racism that are essentially working against our health equity goals. So I'm going to share it now and turn it over to my co-leader, Colleen, to elaborate a little bit more on that.
Thank you so much, Ruth. And I'm so grateful to be here today and so excited to share this executive director role with you. And super grateful for Doug, too, for your leadership, as others have expressed. So thank you. Some other trends that we're seeing that we wanted to share with you is that we're seeing a sense of urgency for healthcare institutions to understand some of the harms perpetuated in historically marginalized community. And there's a real need for healthcare to step out of business as usual paradigm and to really think about creating more power sharing opportunities with communities. And one way, we think to create power sharing opportunities is to kind of pivot into community-led shared equity home ownership models that Tony was talking about that are attracting, consistent national interest and growing support as a pathway to expand BIPOC access to ownership and reducing the racial wealth gap. And in general, healthcare has been slower to join this move towards community-owned models, and we think there's a big need for that. So as I was talking about, Tony was expressing some of these community-owned models, and one of them being community land trusts. And last year, we actually wrote a piece, a crosswalk on healthcare, starting to seed some community land trusts that we can share in the chat box too. You can explore more. There's just an untapped strength in community-led approaches where community residents can really identify, they can co-create, and they can have ownership stake in the solutions that will get us all there to a more meaningful and just world and society. And Build Healthy Places Network is aiming to support infrastructure and systems that can change this paradigm so that future investments and opportunities where healthcare is on the path to thinking about more long-term and community-centered investing. And, a cornerstone of this, and indeed all approaches of meaningful community relationships, is really exploring how we can build institutions and efforts that are worthy of trust. So how can we think about trust building activities? Because that's really where it all starts, and thinking about shared language. And in upcoming months, Build Healthy Places Network is going to be sharing some of these resources and thinking a lot more about community-centered projects and community-led efforts and how we can all join in with community residents. And with that, I'll pass it back over to Ruth.
Yeah, thanks, Colleen. In the last 2 or 3 years, one opportunity I've had the privilege of being involved with BHPN is our sort of more intentional efforts to learn and understand where we could support our rural partners. And it sort of felt like a very conscious shift to address what appeared as our own urban bias, present in our materials, approaches and examples. And we are seeing more attention and movement on multi-sector rural collaboratives, for sure. Healthcare leaders are looking to create multi-sector partnerships with nonprofit organizations, with community building and community development organizations, as well as local governments. And it's certainly, even before the pandemic, it's a critical time, with 136 rural hospitals having closed between 2010 and 2021. So new models, new partners are going to be essential to really ensure health equity includes our rural geographies. And the success of our rural healthcare playbook, which we released in May of 2022, I think really speaks to this moment. And I think we're going to share that in the chat too, if anybody hasn't got the link to that. So an area of growth in terms of looking forward here is on inclusive rural approaches that center community. And we do know that race and ethnicity can intersect with rural geography, and you result in dual increased health disparities. So racial equity is going to be vital to achieving health equity, and we're really looking forward to building on our rural work in 2023. And we're particularly excited to lean into our work on multi-sector approaches to address the colonialism and racism that has resulted in underinvestment in Indian country and Native communities living outside their tribal lands. So next week, we're actually hosting the very first listening circle. And this dialogue will focus on how these collaborations can attract investments that improve health equity and support communities' self-determination. So we have a lot more to say and share, but for now, I'll hand it back to Doug, and I really look forward to hearing more from our panelists. Thanks. Thanks, Doug.
Great, thank you both for the sort of an early view of where BHPN is headed. So I do want to turn back to the panel and really just give you, we're running a little shorter on time than we'd hoped, but at least a couple minutes each to, add perhaps to what Colleen and Ruth said, but where does this work need to go next? And Tony, let's start with you.
Yeah, I would say our big push right now is to really increase the scale and use of shared equity programs. We need more partners, more resources, more policies that actually emphasize and prioritize the production of shared equity housing. And I just want to thank somebody who pasted it into the chat. One of our big partners in this has been NeighborWorks America, and they have been working with a $3 million congressional appropriation to do capacity building for groups that are interested in integrating shared equity approaches. And we're a primary partner of theirs in that effort. We really want to see more philanthropic institutions understand and value the use of shared equity models. And again, the range is from community land trusts to deed restricted programs and everything in between. I saw a reference in the chat to the mixed income neighborhood trust, which is an emerging model that I feel is very impactful. Again, not just focusing on homeownership, but focusing on the entire housing continuum from homeless to rental to home ownership in order to help people be successful and to, again, mitigate things like future pandemics as well as climate change.
Super, thank you. Chris, from your perspective, from your Social Equity Development Corporation perspective.
Yes, thank you. And I think so. A couple of things that stood out. I think either Colleen or Ruth used the word urgency, right? And that's what I definitely feel that is the area that we're working in right now. And also the role of the essential worker. Not only, have these communities been hit hard, doubly hard by the pandemic, but I think to rebuild these communities, we need those kinds of investments, right? We are looking at the mixed income neighborhood trust model. We are looking at different models, but we've really ramped up a lot of our work in the preservation housing, right? And an example of that, we tapped into the Bay Future Fund here in the Bay Area, which also included Kaiser funding. We bought 3 developments in 2020, right at the street here, and we started managing these 3 different buildings, about 90 units. And immediately in that partnership, we started bringing health to them. So we have a partnership with Samuel H. Merritt. They send nurses up there once a week. Every 2 weeks, mental health counselors go up there, right? So that's been going on since the pandemic. And I call it the 3 pandemics: COVID-19, the civil unrest of 2020 with George Floyd, Breonna Taylor, and now just this ongoing violence and craziness that we're still dealing with, right? So, and I think a lot of it, it's tied to health, it's tied to housing. And so I think this work has never been more urgent in my opinion. And that's why I think to have, NeighborWorks, we're part of the NeighborWorks network. I think it's now the time to really continue to keep that urgency front and center and be creative on how we address these challenges.
Great, thank you, Chris. John, from a healthcare perspective, what are some important directions we need to be moving?
Yeah, I'd echo a lot of what's already been said and double down on that: the power sharing, the co-design, the building it, not with just sort of coming in with a model. And I think we've experimented with some of that. We are now working with LISC on some commercial corridor revitalization, City Heights in San Diego, South LA, Ward 7 in Washington, DC, and a bunch of others. And we're not going in there saying it's going to be this workforce model or it's going to be this housing thing. We start with, who do you trust to bring together like what you need? And then who can help analyze and synthesize all that data? And then from all of that, let's work on what the revitalization looks like. We'll be here to cheerlead, we'll be here to fund, and then we'll be here as an anchor to hire, to fund, to build housing, to connect transit and all of that. But to kind of do that. So I think we're looking into exactly kind of what Ruth and Colleen said. And I think all of us to not come in sort of paternalistic. I think there's a humility that we've always tried to carry in all this, but it continues to be a vital thing here. I guess the other thing I would throw in is, and sort of building off that humility is, we can't go it alone. Yes, we are big anchors. Yes, we're well funded, and although the last couple of years we can't quite say that anymore, but we still are well resourced. And not only do we need to bring our voices together as healthcare and like advocate together and find common efforts to like say sway policy or jump in on together, but also beyond healthcare. And how do we start showing the Fortune 500 companies that are not healthcare that you actually have a role in health as well? And that, especially with this ESG movement, and we've talked about, should it actually be ESGH, that health is a major consideration, and you have a role in shaping health equity in terms of how you treat your workforce and their health, the products and offerings, what impact that may have, the community impact and role that you have in a community and the broader ecosystem, especially for policy and voice. So, Strange Bedfellows, us working with a Walmart or, joining forces with a JP Morgan Chase or something like that. I think we need to start thinking beyond just kind of, we can go it alone because we're big and we're the big player in this community. Like there are many others that can bring a lot more too.
Super, thank you very much, John. And Nancy, let's turn to you. You, as we said, have one of the longer perspectives. So what are your thoughts going forward?
I think what I took away most from Ruth and Colleen was the level of energy and the willingness to think outside the box and to break down existing walls and barriers that people in my, dare I say, generation sort of blunted our swords on discovering those barriers. And I am incredibly excited to see the way in which you all are reinventing and inventing the world. I think it does bring me back, for example, the land trust model brings me back to something I said at the very beginning, at the opening, which is we really have to think in terms of reshaping broad structural systems. If the amount of attention for shared equity models existed that exist for home mortgage interest deductions, both of which are policy environmental questions, we would be living in a world with much more equitable housing models. And so I would just take it back, Ruth, to something you said about systems change. We are the best people. You are the best people to speak to that because you're the ones with the boots on the ground and you're the ones with a really good brain on your shoulders. And you can take it forward in a way that has not been done before. So I really urge you and Colleen both to go in that direction. Thank you both.
Great. Well, thank you all. So we are sort of heading out on time, which is always amazes me how fast these times go. But I do want to give you the opportunity. We're not really going to be, we did get some excellent questions and I'm really delighted at the back and forth in the chat. I want to give each of the four speakers a chance to, if there were any takeaways, any last comments. I will say that one question that jumped out at me, and Tony, was the same one that it caught your eye, that we did get, that if you want to respond to, is how have you managed to engage with organizations with viewpoints directly opposite yours? That was a fascinating question. I don't think we have time to all answer it, but I just want to give you each a chance to have a last word. Anybody want to go first? Tony.
Yeah, it did jump out at me, Doug. And, I sort of try to use a sort of two-pronged strategy. One is we have a wealth of data that supports our work. So being able to talk from a factual basis, first of all, without sort of assuming what people's preconceived notions are about the model or what it does or what it limits people's ability to do. Secondly, the best response is we actually have had a program for several years of having resident homeowner ambassadors, the people who are actually benefiting from the work, talking about what their experience is, why they chose to do it, what it means to them. There's no substitute for having those real stories from people who are experiencing the challenge and gaining the benefit of the work that we're doing. So I encourage folks to do that as much as possible.
Super, thank you. John, Nancy, Chris, the last word.
Nothing too deep other than to say, Doug, phenomenal work in getting things going. 10 years is great. And you're stepping down, but I'm glad that you have two capable leaders because the mission is still needed. Despite all the talk about intersectionality, nexus, and all of that, there's still a place for BHPN, and we need to kind of break down walls between us.
Great, thank you. Nancy or Chris?
That was I think what John just said was wonderful, perfectly channeling my mind. And I would just say Godspeed to Colleen and to Ruth. And you've got a whole team of people ready to help you out.
Thank you.
I would just say that I'm excited about what's in front of us. I think we could have conversations now that we couldn't have before the pandemic. I think a lot of times, whether it's philanthropic organizations, whether it's the banks, whether it's whoever, they could kind of blow you off, right? Hey, let's think about this. This is a different type of investment. And now they're not blowing you off. Now it's like, oh, we do need to do things differently. We do need to be creative, whether it's the public sector, whether it's philanthropy, whether it's, the corporate sector. they have to sit down now and listen to these hard conversations. And I think it's a great opportunity for the Build Healthy Places Network and a lot of the partners involved in this. So I'm excited about that.
Great. Well, again, thank the four of you so much for joining us. You really represent the best of the best across sectors. Colleen and Ruth, good luck with everything. I'm actually, Nancy, not going off to Rio. I'm going off to Buenos Aires. I'm going to brush up my Spanish, my Espanol. So thank you all for joining us today. Do come visit us. We'll send a follow-up email with resources and a link to the video, and hopefully, and I believe there's a survey to get your feedback about where we might go with Network Commons in this coming year. So thank you all for joining us, and have a great day.